It's part 7, page 266. It's the joints, and we're looking at the elbow. The elbow is a nicely shaped joint, partly because it gets to grab the trochlea of the humerus with the trochlear notch of the ulna, just the way you like it. So this little anterior little lip that comes up this way is the coronoid process, and the posterior lip that comes up this way is the olecranon process back here. When you're in this position and you're leaning right here, you're leaning on your olecranon, as it were, or your ulna. So that's the nature of the elbow. Look how extensive this is. Okay, this is really quite the extensive joint. This is all fluid all the way around here. We have a little extra bursa right here, just the way you like it. And it's preventing the tendon of triceps from getting too hung up in this region right there. Okay, you can see the complexity of tendons that circulate. There's that annular ligament around the head of the radius, and there's all these other nice features here. The elbow is a pretty stable joint. It can be stressed for a variety of reasons because we have a tendency to use our upper extremity in ways that are extraordinarily inappropriate. Okay, some of which involve martial arts, and some of which just involve the yanking of things that would be better done if we had the proper tools. Put it that way. Okay, so the next one that I want to come to over here is the hip joint. The hip joint is really fascinating because do you see right in the middle of the hip joint, this is the femur here, the neck, the head. The head is going to the acetabulum here, which is made of the three bones of the hip, the ilium, the pubis, and the ischium in the back there. They all come together to form this nice invagination here. Notice that there is a connective tissue ligament coming through. It's the ligament of the head of the femur. It also conducts a van, my favorite expression for neurovascular bundle. So there's a vein, artery, and a nerve coming through here, just the way you like that. So when you're doing hip surgery, consider the idea here that you're actually you're going through a lot of material, including neurovascular bundle, when you're replacing the hip. So be respectful of the degree and the seriousness of that particular surgery. Okay, so we're held together by a number of ligaments. There's 3 of them named for the bones of the hip. So we have the iliofemoral coming from the side here, from the ilium to the femur. We have the ischiofemoral coming from the posterior back here to the femur. And then we have the pubofemoral coming from the front or medial aspect from the pubic bone to the femur. That's all you really need to know there. Okay. So then we have our temporal mandibular joint right here. Okay. So here's the sort of like this more superficial look here. Here's a deep look. We have our condyloid process coming up here from the mandible, and it's going to the articular surface up here on the temporal bone. Remember, the temporal bone has this external auditory meatus, just the way you like it, in the styloid process and all that. But now look how complex this is. Okay, do you see we have articular cartilage here? We have articular cartilage here. But notice that we have an intervening disc that they're referring to as the articular disc, and that we have synovial fluid on both sides. We have synovial membrane feeding that synovial fluid all the way around up here. So that means we have options. Okay, so this lower option here is a hinge joint. The upper option is much more of a gliding type of joint. And so we have our friend right here who's going to demonstrate for us some of that type of movement here. So she could actually, and this is referred to as the excursions of the teeth. If you go to your dentist and she or he says, I'm going to test the excursions of your teeth. So, and they tell you to do different things. So you could move from side to side. You could move protracted or retracted, or you could just bite simply. Okay, so you have these options, and it's this top joint up here that provides you with the gliding option. Okay, so that right there is just the way you like it. Side to side, of course, when you're, before I get to side, just biting into something using the simple hinge means that we get to use these incisor teeth here. You get to bite into the apple, right? And then you take that little bite and you push it over to the side with your tongue there where you have molars, and you grind that apple up. Okay, so the grinding action is much more in line with side to side, front to back, etc. Okay, so that's that deal right there. And then we're going to be considering other types of things. I just spoke about dislocation. So that was at the shoulder joint, the most commonly dislocated joint in the body. And so there's some people need to get their shoulder joint put back into the socket quite regularly. Okay. So then we have certain types of inflammatory conditions referred to as, in this case, bursitis, when it just involves a bursa or tendons, especially a tendinous sheath. So that's something that could be found at the elbow, at the wrist, any sort of repetitive motion that causes inflammation. Then we have arthritis. The most common arthritis that we're familiar with is osteoarthritis. We call it wear and tear arthritis, and it usually involves a buildup of calcification. It could the calcification could overwhelm a tendon. It could overwhelm the articular surfaces within a joint. Some people actually have complete closure of the joint because the osteoarthritis is so far developed. Another type of arthritis, which is not wear and tear, but has its origins in autoimmune issues, is rheumatoid arthritis. A completely different program there, and I'll let you read about that at your own leisure. It's quite an unusual type and more rare than the osteoarthritis, which, if we're fortunate enough to live long enough, we're also, how shall I say, the downside is that we get more of that. Okay.